Hi, I'm Scout. I'm from the National LGBT Tobacco Control Network. I'm here at a meeting of all the other disparity networks, and so I thought I'd take a little bit of video to show you who they are and what it is they do.
My name is Kevin Collins. I have the pleasure of working with all of the national networks from the Centers for Disease Control.
Excellent. So tell me, what do you think is one of the important reasons, why is it these networks need to exist?
Networks provide an extension of our office into populations that, frankly, we historically have had difficulty reaching. So the national networks provide expertise for us into those communities as well as credibility.
And is this the most...
My name is Bill Robinson. I'm the Executive Director of the National African American Tobacco Prevention Network.
Excellent. And so tell me, what you think would be some of the strengths, or one of the strengths of that network?
Well, that we are very good at engaging communities of African descent in tobacco control. And so we do education, help with policy, and help build capacity in communities to do just that.
Excellent. You got some big work going on with a big issue on the national front, right?
Yes, we do.
What would that be?
Yes, we do. That is menthol.
Okay.
Very instrumental in getting provision added to the new FDA legislation that will mandate this oversight committee to address menthol in the first year. And as a result of that, we're having a conference in 3 weeks in Washington, D.C., a 2-day conference where we'll be addressing it as scientists and community advocates on the ground will be kind of cross-educating each other about that issue.
Excellent. Good luck with all that. Thank you very much.
Jeanette Lopez, I'm National Director of the National Latino Tobacco Control Network.
Who are you?
Aida McCammon from the National Latino Tobacco Control Network.
Excellent. And tell me this, what do you think is one of the real strengths of the National Latino Tobacco Control Network?
The diversity in our network.
Really? And didn't you have a little bit you did in Puerto Rico recently?
The expertise that we can offer, the knowledge of our community.
And the knowledge of the experts that are part of our steering and advisory committee.
Excellent. And then what did you do in Puerto Rico recently?
Well, we just supported the Puerto Ricans who have taken the lead in going against the tobacco industry. RJR in particular was trying to put in a curriculum funded by them into the schools. Imagine that.
And you were able to help the local folks?
We were able to help the locals, but they were the ones that did the work. We were there to support them, but they are the leaders in this field.
Good. So are the schools?
I'm Janet Porter, Program Director, Break Free Alliance.
What's that?
Education Council.
And what do they do?
Break Free Alliance is a national network dedicated to ending the cycle of tobacco and poverty.
Excellent. What about you?
I'm Program Administrator for Break Free Alliance, working for this excellent program director.
Excellent. So tell me, what do you think is one of the strengths of that network?
Well, I'm the biggest strength.
Well, we know that, but in addition.
And she is strong.
Right.
The strength of our network, I think, are probably our coordinating council members and the folks we built relationships with to kind of lead this network.
So give me some ideas. Who might those be?
People actually serving the population. So agencies, national organizations that actually reach the people we want to reach.
Excellent. Well, come on, give me some names. Just give me a specific.
Salvation Army.
Oh, I've heard of them.
Rescue Mission.
Oh, yeah.
National Coalition for the Homeless.
National Commission on Correctional Health Care.
And you have something coming up soon, don't you?
We do indeed.
What is that, Lisa?
Well, we just happen to have an expert panel on tobacco use and homelessness in Washington, D.C. on October 21st. It's invitation only, but we're trying to get a variety of people there to try and approach this at a bunch of different angles. Researchers, formerly homeless people, people who serve the homeless population, funders,
and homeless people
policy
themselves.
people.
Excellent, right?
Yes.
And so,
Excellent. Good job. Keep up the good work.
Yes, thank you.
thanks, guys.
My name is Jillian, and
Great.
I work for Appeal Promise Network.
Great.
My name is Arfana, and I work for Appeal Promise Network.
Excellent.
My name is Rod, and I work with the Appeal Promise Network.
Great. Okay, so give me an example of one of the strengths of Appeal.
Well, according to the evaluation,
Right.
it is strong leadership in the trainings that we provide.
So what kind of trainings?
We do leadership trainings, we do trainings that includes planning.
Sorry. Well, that's deep.
Training on how to avoid running into people.
Exactly.
Wow,
Especially Dave, right?
How to set up videos correctly so we don't get injured.
Okay, excellent. And give me an example. So you cover territories from where to where?
Oh, from as far west as Guam to as far east as tip of Maine.
A lot of coverage, and then I guess a few different languages too?
Yeah, about 53.
53. Some of the challenges. All right, thanks very much, y'all. All right, tell me, who are you and who do you work for?
I'm Lisa Kerfoot and I work for the National Native Commercial Tobacco Abuse Prevention Network. And I'm Ursula Hill, I work for the same network.
Great. So tell me one of the strengths of this network. All that, huh?
The strengths of the network is getting all the tribes together as one in a conference.
Excellent. So you run a big conference each year.
Pretty much, yes.
Excellent. That sounds good. All right, keep up the good work. Okay, and again, I'm Scout, and this is
Sasha,
and we are part of the
National LGBT Tobacco Control Network.
Okay, what do you think are the strengths of the National LGBT Tobacco Control Network?
I think one of the big strengths is that we're really a hub linking LGBTs to tobacco control professionals. We do a lot with cultural competency, reaching out to quit lines to provide tailored strategies, and also we are really trying to use the tobacco control movement as a springboard to include all LGBT health disparities within the healthcare system.
All right, now get on back. No, these things won't be used.